the world's foremost authority on the subject, and also he has an institute north of San Francisco, and it is called True North Health Center. So Dr. Alan Goldhamer is the director and founder of this institute. Additionally, he has written multiple scientific articles and publications, as well as relevant for this evening is a book titled Pleasure Trap, and an accompanying cookbook that focuses on SOS, that is a sugar, oil, and salt depleted or reduced plant-based whole food diet. Furthermore, his experience of treating in-house in his institute for last 35 years, he has trained or treated 25,000 people based on his water-based prolonged fasting. It is a different kind of intermittent fasting, different than what you normally hear about, but the success is very impressive. With that short introduction, I invite our distinguished keynote speaker of the day, Dr. Alan Goldhamer. So Dr. Goldhamer, and please take over.
Well, thank you very much. I'm excited to be here this evening to share with you some of the experience that we've had with this use of water-only fasting. We are defining water-only fasting as the complete abstinence from all substances except pure water in an environment of complete rest. It turns out that an important part of the benefit that occurs during fasting has to be associated with rest. If you allow an individual to be normally active during water-only fasting, the increased use for glucose increases gluconeogenesis, and it shifts the desired breakdown of fat into a less desirable breakdown of protein. So this rest is an important part as well as not eating. The fasting that we're doing ranges from 2 to 40 days. Average fasting clinically is 1 to 3 weeks. Sometimes patients, depending on the problems, may require multiple fasts. We're actually excited. We've recently acquired a Hologic DEXA scanner, which has allowed us to do very detailed and accurate whole body composition assessments during and after fasting. And as you can see from this graph here, what we found is that not only is fat preferentially mobilized during fast, and so what ends up happening, if you notice this graph here, fat, the black line, continues to reduce both during fasting and after fasting, during refeeding. The weight that's gained during realimentation is actually water, glycogen, and fiber, and not fat. So, you know, as I said, this demonstrated quite convincingly that the weight that's lost during fasting is, in fact, fat, and in particular, it's visceral fat, the fat that accumulates around the organs and abdominal area. We're in the process of starting a study actually looking at this in detail, body composition changes, but it is the first thing we've seen that really seems to preferentially focus on visceral fat. This brings up the next issue which I wanted to discuss, which is high blood pressure. This condition is so common now that a significant percentage of people, including younger people, are now being diagnosed with hypertension. And unfortunately, the medical management of hypertension says that you take drugs for the rest of your life. The guarantee is that you'll be sick forever and you'll never recover, because conventional medical treatment doesn't address the reason why people develop hypertension in the beginning. We've done a study. We took 174 consecutive patients with high blood pressure in a paper that was published in JNPT, and we were able to demonstrate the largest effects that have been shown in treating high blood pressure in humans. If you look at what used to be called stage 3 hypertension, where people's systolic blood pressure is 180 or higher, that average effect size was 60 points, as you can see from this graph. That doesn't even take into account the fact that these people started off medicated, they ended not medicated. So it's actually 60 points plus whatever effect the medication may have been having. And all 174 out of 174 people were able to lower their pressure enough to eliminate the need for medication. We later published a second study that looked at borderline hypertension, those patients that had a blood pressure high enough to increase the risk of dying, but not high enough to justify medication. Medications are not routinely used with all patients that have moderate levels of hypertension because the risk of death and debility from treatment exceeds the benefit until your blood pressure rises to a certain level. That is, in fact, the definition of hypertension, the level at which blood pressure benefit from medication is exceeded by the cost and detriment to the body. And in this case, we had 68 patients with borderline hypertension, and the majority of those, all of those patients reduced their pressure 82%, actually below 120/80. And this was in fasts of 5 to 40 days. After we completed those studies, we were approached by the International Union of Operating Engineers, one of our California's more powerful labor unions, and invited us to present information on our approach, and ultimately they decided to support a study. We took the first 30 consecutive members of the union. They underwent an average of 3-week stay and lost 26 pounds, reduced their blood pressure 30/11. At 12-month follow-ups, they had maintained much of the results, and they reduced the cost of care to the union more in the first year than the entire cost of the program. And as a consequence, we went on for over a decade working with this particular labor union, treating over 100 of their patients with diabetes and hypertension with very significant and demonstrable results, both in terms of the clinical outcome and the savings to the union. So the question is it safe? Is it safe to take human beings in a medically supervised setting, put them on a long-term water-only fast? And so in order to answer that question, we did a study. And we took, the study ended up being, is fasting safe? A chart review of adverse events. And we published this 2018, looked at 1,100 patients that had undergone water-only fasting. The conclusions were that the majority of adverse events were mild to moderate. They were predictable, expected during fasting, that there was a correlation between aging and adverse events, but not severity, which was really the first time that was shown that older individuals, in other words, older than 65, could safely fast. And the conclusion was that the protocol that we're using at the True North Health Center was, in fact, safe. This publication of this first safety study on fasting has really opened up the use of fasting for anybody that needs to get through an IRB. The real question then is, okay, it's safe and it seems to work. How does it work? What's really going on? What are mechanisms that are occurring in this ancient practice? Well, one obviously is weight loss. Weight loss is a pound a day, and what we've shown now, as I previously showed on the slides, the majority of this weight actually is in fact fat and visceral fat. And we also notice there's a natriuretic effect in fasting, the selective elimination of sodium. This is a very powerful effect, much more powerful than what we find with, say, diuretics or hydrochlorothiazide and the like. You get a powerful diuretic effect, which drops the blood volume, which drops the blood pressure, allows non-healing wounds to heal, impacts symptoms of congestive heart failure, etc. The traditional justification of fasting was the idea of detoxification, the idea that people are toxic, that they have accumulated metabolic products inside their cells, things like PCB and dioxin and pesticides and residues. We know, in fact, that this is, in fact, true because you can take a fat biopsy and break it down and find several hundred of these chemicals in various concentrations in people. And during fasting, these materials are rapidly mobilized and processed and eliminated, reducing total body loads during fasting, both of exogenous and endogenous toxins. Endogenous toxins being substances that, although may be detrimental, aren't traditionally toxic. They may be cholesterol or fatty materials that are normal materials but accumulated in abnormal quantity or in the wrong place, as occurs with visceral fat. Enzymes are induced during fasting both for macronutrient mobilization, things like gluconeogenesis, glyconeolysis, lipolysis. These are all induced during fasting, and they persist, it turns out, after fasting. So you are more efficient not only during fasting, but after fasting at mobilizing glycogen stores, fat stores, as well as gluconeogenesis in terms of protein mobilization. You also induce enzyme systems associated with detoxification, which is how those materials get out of the body. And we also believe that those detoxifying enzyme systems persist post-fasting, and they also seem to accumulate. So that every time somebody fasts, they get more and more efficient at it. Just like every time somebody exercises, the glycogen mobilizing enzyme systems become better. That's part of what being a conditioned athlete is this repeated induction of these enzyme systems. Insulin, the hormone that drives sugar from the bloodstream into the cells, is profoundly impacted in fasting. And in fact, that may be why about 80% of our type 2 diabetics are able to achieve normal blood sugar levels without medication. Now, granted, they have to continue to be willing to eat healthy and exercise in order to maintain the results. But nonetheless, it's a very rapid way of normalizing blood sugar levels and eliminating the need for people to use medication. The fasting mechanisms also include dealing with the gut, that tunnel that starts in your mouth and ends in your rectum. The microbiome, the 5 pounds of bacteria that live in your intestinal tract, are a very important part of your immune system. 5 pounds of bacteria eating, drinking, and defecating inside you right now. What your bacteria defecate in you depends on what you feed them. And if you want them feeding you fertilizer like vitamin K rather than toxic waste like TMA, then what you need to do is feed your gut the food that they're designed to eat, which is soluble fiber, so your vegetables and sweet potatoes, not the animal foods that lead to increased production of TMA. The fasting affects the gut by affecting, we believe, this process of gut leakage. The gut has a membrane that filters out everything except very small molecules, much like this screen here would filter out the bugs. The problem is if the screen became damaged, the bugs could get through. If your intestinal mucosa membrane becomes damaged, you can leak material through, gut leakage, proteins and other materials that shouldn't be there, and that in genetically vulnerable people, the immune system can react inappropriately and lead to autoimmune diseases and other problems. If you look here, the difference between one face and the other is what we call smoker's face. Smokers develop this premature aging because the free radicals from cigarettes actually cause collagen tissues to cross-link, and that's what wrinkles are. It's interesting, some people claim that smoking actually in some senses protects you against things like lung cancer. And technically that's true. 80% of patients that smoke don't get lung cancer. But it's because they die of heart disease before they live long enough to grow their tumors. Because in addition to causing lung cancer, smoking causes the animal lining of the vessels to be damaged, leading to heart attacks and strokes. So I guess theoretically, if people made smoking even more dangerous, maybe we could advertise it as cancer safe. I don't know. Fasting also normalizes the autonomic nervous system that balances the things you don't think about. Fasting also has a powerful psychospiritual effect. It's interesting, with all the different religions in the world, the Jews, the Jains, the Hindus, the Muslims, the Christians, even though they don't agree on many things, the one thing they do have in common is a tradition of fasting. This is an ancient practice that's recognized in most all of these traditional religions. And I think it's because it changes the way you feel and think about yourself and the world around you. Fasting enhances the immune system. It doesn't suppress the immune system. And in fact, this concept of autophagy, the idea of the body getting rid of cancer cells and getting rid of other unwanted debris, yielded a gentleman 2 years ago the Nobel Prize for his work on autophagy. And autophagy appears to be profoundly affected by fasting. Fasting also affects taste adaptation. Good foods don't taste good to people when they've been used to eating greasy, fatty, slimy, dead, decaying flesh, highly processed, salty, sugary, fatty-induced foods. They become addicted to the artificial stimulation of dopamine in their brain from what we call the pleasure trap. And as a consequence, to get people to eat whole natural foods is undesirable. It takes a month on a low-sodium diet and maybe 3 months on a low-fat diet to really make that adaptation. But that adaptation can happen much more quickly with fasting. So that at the end of fasting, good foods actually can begin to taste good, and therefore improving dietary compliance. We did a study on this adaptive stage. We were able to quantify minimum detection thresholds to salt, sweet foods, fatty foods, and what we were able to demonstrate was that there was a decreased liking of salty, fatty, and sweet fatty foods as a result of fasting. People actually have a change, a measurable change in their taste perceptions. Fasting, just in brief summary, decreases a bunch of things like glucose and insulin growth factor 1, which is associated with aging. leptin, which is associated with reduced inflammation. It reduces blood pressure and heart rate. And mammalian target of rampomycin, the mTOR, which is increasing autophagy. The microbial load, as I mentioned, is rebooted. That whole bacteria microbiome, the 1,000 strains of bacteria that are protecting us from things like viral diseases, et cetera. Inflammatory markers like IL-6, which is associated with the cytokine storm, which is associated with untoward impacts, is also reduced in fasting, as is objective measures of inflammation, the acute phase reactive proteins and other objective markers of oxidation inflammation. And fasting reduces abnormalities associated with metabolic syndrome. It's the most effective way of reversing metabolic syndrome that I've come across. Fasting increases things like adipectin, ghrelin, and things associated with satiety. It downregulates mechanisms that increase mitochondrial biogenesis. Beta-hydroxybutyrate, which is the main fuel you burn in fasting, is associated with increased BDNF. And BDNF is the chemical that's associated with protecting you against Alzheimer's disease. In rats that are given exercise ability or that are periodically fasted, they tend not to get Alzheimer's disease, and in part that may be because of the effect on BDNF. Fasting affects insulin sensitivity and cellular stress resistance and adaptation. That's talking about the idea that cancer cells don't like the fasting state, and healthy cells are protected in cancer, which is why we're going to show you a quote from Walter Longo, who mentions that there's a profound effect with the use of fasting on cancer, both in rats and now more recently in humans. And the gut microbiome and diversity is also profoundly affected by fasting. Walter Longo quote in the Journal Metabolism 2015 is that combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone. And actually, when he published that, I think there was an attitude change about fasting, because many of the pharmaceutical companies said, oh, we can get a better result with our traditional treatments by using this ancient practice of fasting. And at that point, I think fasting began to shift from being criminal quackery to cutting-edge research. I'd like to share, if I have some remaining moments, I'd like to share the results of one particular case report that we published in the British Medical Journal. This was a woman that had been tracked for 2 years with follicular lymphoma, a type of lymph cancer. It was stage 3. They had determined by the excisional biopsy. They had tracked the progression. They had assured her that diet didn't matter when she asked. They also told her that fasting was criminal quackery. Nonetheless, she decided, despite discouragement both from her family physician as well as the oncologist, to come to the center for medically supervised water-only fasting. We fasted her for 21 days, during which time her tumors disappeared. We could no longer feel these previously externally palpable tumors. She refed during the 21 days. She lost 22 pounds. At follow-up, although she still had some residual neutropenia, they could not find evidence of her tumors. By 6 months of a whole plant food SOS-free diet, her white counts had normalized. Her weight, you notice, continued to reduce. I explained to this patient that it was very important that she stuck to the whole plant food diet, or it could be fatal, because I'd track her down and kill her. But so she believed me because she stuck to the diet. At 12 months, we were able to do a follow-up CT scan that showed this shows the reduction during fasting of the tumor, a couple of her tumors before and after. On follow-up, we were able to do a whole body CT scan showing that, in fact, that she had maintained herself cancer-free. At that point, we wrote up this case report for BMJ. It was published. They said, listen, you need to do a follow-up, though, because some people spontaneously go into remission. And so we followed this patient for 3 years. She followed the dietary program. We got a follow-up CT, whole body CT at 3 years, showing that she had maintained herself cancer-free. And they did eventually publish this paper as well as a follow-up. You know, she had maintained her weight loss through that 3 years, which shows not only can people get well, but it is possible, at least for highly motivated patients, to stick to a health-promoting whole plant food diet. True North Health Center also is actively involved in training doctors. Texas A&M and other schools have recognized us, and now their residents can rotate as part of their training. We're a naturopathic residency site. Those doctors come for a year after they complete their primary training. So we have between 3 and 6 doctors at a time training to actually get more people familiar with using these very safe, simple, and ancient practices that are apparently so effective at helping people deal with the diseases of dietary excess. I really wanted, I know I moved really quickly through this, and I'd be happy to answer any questions. I appreciate your attention this evening.
The first question for you, Alan, which I can see in the chat box, it's a very interesting question, a very common question though. How does water fasting impact LDL?
Well, LDL levels, of course, will drop during fasting, as will all lipids, triglycerides. What's interesting enough is total cholesterol levels will increase initially, in part because you're actually mobilizing materials from inside the vessels. There's no place for it to go but in the bloodstream. So there's a temporary increase, although the overall effect on lipids is quite favorable.
So the next question is, what are the effects of IF on hypothyroidism?
Well, I don't have as much experience with intermittent fasting as I do water-only fasting. I can tell you that thyroid function during fasting, of course, reduces as part of the adaptive mechanism. And we know that there's an interesting correlation between the gene associated with most hypothyroidism is Hashimoto's thyroiditis. There's an HLA-DQ gene associated with that that's the same gene associated with gluten sensitivity. And some people believe that that gluten doesn't just contribute to celiac disease in 1% of the population, but it also may be a factor in contributing to Hashimoto's thyroiditis, that the immune system can react to the thyroid rather than the intestinal tract in a similar destructive way. We use a diet that's free of gluten, and so I think that may be one of the benefits, and certainly fasting has an effect on thyroid function, but it's not sufficient to eliminate the need for thyroid replacement in people that have long established histories of thyroid replacement therapy.
How to prevent becoming hypoglycemic when fasting for a diabetic patient?
Well, interesting, hypoglycemia is a normal state in fasting because your brain changes, your brain burns, the majority of your is your major burner of glucose. The brain itself changes from burning glucose predominantly to burning beta-hydroxybutyric acid or ketone body byproduct. So the brain is burning fat. That's what fasting is, the ability of the brain to change from burning sugar to burning fat. That's why chimpanzees can't fast. They can't go long periods of time without gluconeogenesis depriving their protein stores and killing them. Humans had to be able to fast. This is a biological adaptation. Because our brains are 2.5 times bigger, they're ridiculously large, big glucose burning machines. If we didn't have the ability to fast, or put it this way, every human that didn't have the ability to fast died. Because as soon as spring came late, all the humans wouldn't make it. We couldn't go but a week or so. Well, because the humans that had the ability to fast survived, today virtually all humans can fast, because our brains change fuels. We have a bi-fuel brain. So this is a critical, necessary adaptive mechanism. And all we've done is taken this very ancient practice and applied it in a very unnatural situation. And that's a situation where people have been given persistent dietary excess. The obesity and the metabolic syndrome that's killing people today is reversed with this process of fasting, and it makes the transition to healthier eating much more efficient.
Thank you, Alan. Here is another interesting question. Does the brain get enough protein and sugar to function on a water-only fasting program?
Yes, well, what we found with 25,000 people having successfully completed this program is that the brain does, in fact, get enough sugar, because the amount of sugar needed is very small once you're in ketosis. Once the body's converted, it's burning predominantly beta-hydroxybutyric acid. So as long as there's enough total storage, the body does fine, unless you begin to increase metabolic needs by, say, for example, allowing people to exercise. If you're exercising vigorously during fasting, you would need significantly more glucose to maintain muscle activity. That would have to come from the breakdown of protein. Because once you've depleted your glycogen stores after about 48 hours, the only place to get sugar efficiently is from protein breakdown. And so that's one of the reasons why resting is so important if long-term fasting is to be implemented. And I just want to point out, fasting is not for everybody. There are many individuals and conditions that fasting would not be appropriate, not the least of which is people on medications that can't be safely discontinued. So I'm not suggesting fasting is the answer for everybody, but for people that have metabolic syndrome and are dealing with these oftentimes very serious disorders, this is a safe and effective way, when it's done properly, to give the body a chance to do what it does best, and that's heal itself.
What is the relationship between exercise and fasting? And
Right.
can you exercise vigorously while fasting?
Now, you can't, you shouldn't exercise vigorously when water fasting because of this gluconeogenesis problem, this protein mobilization. But what we do allow is gentle, you can do yoga, meditation, you can do these types of gentle activities, but you wouldn't do, you know, that's not the time to do your Kundalini yoga and stuff like that.
Is it okay to do vigorous exercise after consuming plant-based diet?
Well, yes. I mean, once you're back on your whole plant food diet, vigorous exercise is a critical part of health. Health results from healthful living. That's diet, sleep, and exercise. That means a whole plant food diet that's free of salt, oil, and sugar, regular, consistent exercise, walking, hiking, biking, swimming, stretching, yoga, this type of thing, and generous sleep. One of our most important activities is sleep. And we need to get enough sleep so we can wake spontaneously feeling refreshed. If you get good sleep, good exercise, and an appropriate diet, the body heals itself.
How is the gut biome fed on water-only fast? And are
very good question.
Resistant? Yeah, and are there resistant starches used for that purpose?
Yeah, there's a profound reduction in total gut microbial load, and what we believe is happening. In fact, we've done the first study looking at long-term fasting and the gut microbiome. We did it with Luigi Fontana from Washington University, and actually the results of that study, I have not seen the data yet, but what we did is we took patients, went through 21 days water fasting, and looked at the microbiome before and after, and they were doing really sophisticated breakdowns of the 1,000 strains of bacteria and looking at the changes. But again, I haven't seen the final data, but what we believe is happening based on what we see clinically is that there's a rebooting. It's like taking a corrupted hard drive and turning the computer off, and you turn it on, and there's a complete recalibration that seems to be happening. And these conditions like ulcerative colitis and Crohn's disease, these conditions respond very dramatically. And so we believe that part of the reason they're responding is because you're starting to get back your normal gut microbiome. And then we go on this whole plant food, plant soluble rich fiber diet, and it seems like it's effective at resolving these issues. And we'll know more once we get some of our actual data back.
So we have another question which says, what are the optimum types of protein for people that are engaged in an hour or more of exercise, jogging, etc.?
Well, the best source of protein is plant-based proteins. The quantity and quality of protein that you need, including the amino acid breakdown, is best provided by a diverse plant-based diet. There is no need to use animal products in order to meet the quantity or the quality of our protein needs.
Okay, so here is a tricky question. It says, I like milk with my tea in the morning. What is the maximum milk that I can take?
Right.
Which I will still be considered IF, 1 teaspoon or, you know, half a teaspoon.
Well, fortunately, probably the most obnoxious food that humans eat in industrialized countries is dairy products. In my opinion, it does more damage than any other single food. And so fortunately, in our approach, we wouldn't be using milk at all, and so you wouldn't have to worry about that question.
Great. So the other one is a very fundamental question about fasting. What do you think about fasting without water?
Well, I wouldn't recommend fasting, dry fasting, even though, now, maybe for religious or spiritual, there may be all kinds of people that advocate it, but from a physiological standpoint, from a health standpoint, I would discourage this practice because without a solute to allow you to put the toxins that your body mobilizing in, you're not going to have an efficient ability to mobilize and eliminate those products. That water becomes an important part, not only of keeping you alive and preventing dehydration and preventing kidney shutdown. I might mention one of the advocates of dry fasting actually passed away recently from dry fasting. There was kind of some internet talk about that. Because if you go on a dry fast for too long a period of time, what will happen is you can shut your kidneys down. So we don't consider it physiologically sound. We don't consider it a health-promoting practice. If it's done for spiritual reasons, that's not my domain, so I wouldn't know how to advise about that. But from a physical standpoint, we recommend adequate water intake. And that, in our clinic, that means we're monitoring urine and specific gravity, but normally it's going to be at least 40 ounces of water a day, as much as twice that in order to maintain a balance.
This is a bit of a medicine-related question. When you start the supervised water fasting, do you continue the medicines that patients have been prescribed for over years, or with water-only fast, do you also prescribe those medicines, or they have to forego during that phase?
Yeah, that's a very important point. What happens when patients come to True North Health Centers, they're always working with one of our attending physicians. We review the full medical history, physical exam, laboratory work, and the first step is to wean off the medications, with the exception of some rare, true hormone replacement therapies, thyroid replacement, et cetera, may be, the medications have to be modified, but they can be used with fasting. All other medications are discontinued. Now, what's exciting is that most people are medicated not for their condition, but for their diet. And the moment you change their diet, the need for medication begins to drop. And most of our patients, for example, the hypertensive patients, we can wean off their blood pressure medications within a few days of diligently applying a whole plant food SOS-free diet. And then we'll go into fasting, and the fasting has a much more powerful effect on their blood pressure than their medication ever did. So it's very important that these medications be first weaned down and then we introduce fasting. We may go through modified fasting, juice fasting, or just careful eating initially in order to safely withdraw those medications. If you can't safely withdraw a medication for some reason, then we would do a modified fasting regime rather than a water-only fasting regime.
This is a bit tricky question. Which is more effective, water-only fasting or fast mimicking diet?
Well, water-only fasting has a profoundly geometric increased impact. That's why they call it a fasting mimicking diet. It's trying to mimic the effects of fasting. But fasting mimicking diet may be infinitely more practical because it can be done on an outpatient basis with the supervision of a doctor. It can reach massively more people. Not everybody is a candidate for water-only fasting. Not everybody needs water-only fasting. And so the fasting mimicking programs, I mean, Dr. Longo has 10,000 medical offices using his approach to fasting mimicking diet. He's going to reach massive numbers of people. What we are at True North Health Center truly is a research facility disguised as a clinic. And so we're not necessarily saying this is the most practical approach to reach the most people. We're just trying to show what's possible in terms of giving sick people a chance to get well. And we believe that water-only fasting may have a profound effect on healthy people, getting them to stay that way. In fact, the Buck Institute just released an article last week saying that they thought one of the keys to managing cytokine storm may be getting people into a ketogenic state. And certainly water-only fasting wouldn't be available to everybody, but perhaps the type of work that's being done with intermittent fasting and Prolon and the rest of this may have a practical application for individuals that don't have access to a facility like True North Health Center.
Is it okay for someone with post-heart attack related medication to go for water-only fasting?
Well, there are some heart medications like anticoagulant therapy, for example, that you wouldn't discontinue, certainly not arbitrarily, because the risk of stroke would be significant. If a person's had a pulmonary embolism, myocardial infarction, a stroke within the last year, we don't use water-only fasting, not until they're able to safely be stabilized off these medications. And part of that is there is a physiological dehydration that occurs in water-only fasting that, at least in theory, might increase people's risk factors. Anticoagulant therapy is the same thing. You don't just discontinue anticoagulant therapy because the risk of stroke would be very real, and the profound effect of stroke is so great that the risk-reward ratio would not be favorable. There are many conditions, severe kidney disease, where you wouldn't, if a creatinine level is over 2.0, we don't use water-only fasting. It's one of the reasons why it's very important that before water-only fasting be considered, a proper history exam and laboratory evaluation be done so that only people that are good candidates for fasting do that. That's also one of the reasons we offer free phone conversation with me to anybody that's interested in finding out is fasting appropriate for them. They can submit their medical history to us without any cost. I'm happy to tell them whether this kind of approach might be worth discussing, and we can hook them up with, whether it's at the True North Health Center or one of the other facilities around the country that does fasting supervision. We can hook them up with a doctor that is familiar with these things, and or they can use our phone. We have our attendings are available through phone consultation as well. If they need to get into detailed health consultation with a doctor that's not an idiot, they can utilize one of our attendings through our telemedicine telehealth system. But we do offer free phone conversation with me to anybody that's interested in knowing if this type of an approach is appropriate for them.
Well, that's very useful to know, Alan. Thank you. Here's a question which says that, do you recommend regular fasting for healthy children once a week in 15 days?
Well, I recommend regular fasting for every single person, including children, every day. I believe that we should limit the feeding window, whether it be 12 hours or 16 hours, depending on the person and the age and the circumstances, but that we should fast every day. It's between the last meal, supper, and then when you break your fast in the morning, called break fast. I don't think people should be eating all day and all night long. And having a period of 12 to 16 hours of fasting every day not only helps prevent overeating, but also that amount of fasting may be enough cumulatively to induce metabolic changes that cumulatively have profound beneficial effect. So I think that it's a good idea to make supper your final meal. Stop with all the late night eating. Don't eat 3 hours before you go to sleep. Get a good night's sleep. And I think fasting every day for everybody is probably a health promoting habit.
Here is a question from Dr. Padma Srinivasan. What is the strategy for someone with metabolic syndrome, but the person has no need for weight loss?
Well, metabolic syndrome doesn't necessarily require excess weight, and it doesn't really change our approach. You can fast patients, although honestly, a person that's very thin obviously would not be doing a very long fast compared to maybe a person that has more reserves. But sometimes even short periods of fasting have a relatively limited effect on reserves, but have a profound effect on things like insulin resistance and the gut microbiome. And sometimes when people are very thin, we still may use fasting, but it may be very brief periods of fasting rather than these longer 5, 10, 20, 40-day fasts.
So there are some questions on plant-based food. I'll just combine them. So it's basically what type of plant-based proteins are good, and then it goes on to say that plant-based food which we are getting from stores, is it okay to eat?
Yes, so we encourage people to buy whenever they can organically grown fruits and vegetables. We believe the diet should be exclusively whole plant foods and SOS free. SOS is the international symbol of danger, and it stands for salt, oil, and sugar. Salt, oil, and sugar are chemicals added to food. They're not actually whole food. They're chemicals that are added to food that fool the satiety mechanism of the brain and lead to overeating. That's why people are fat and sick. That's why 2/3 of people are overweight or obese. That's where metabolic syndrome comes from. So I say escape the pleasure trap and avoid the salt, oil, and sugar, the animal foods and the highly processed foods, and fill yourself up with fresh fruits, vegetables, minimally processed whole grains, gluten-free preferably, beans, limited amounts of nuts and seeds. If you do that, you get the quantity and quality of nutrients you need. You avoid the dietary excess. If you're a male, you're going to lose about 3 pounds a week down to your optimum weight. If you're a female, about 2 pounds. Males lose about 50% more weight, in part because they have testosterone, which is a fat-burning hormone. Women, on the other hand, have estrogen, which is a fat storage hormone. So women have to work twice as hard for half the results, but, you know, don't shoot the messenger. I don't make up the rules.
Is juice fasting, where we consume green juices and veggie juices, safe for everybody? And which individuals should not attempt such a regimen without medical supervision?
I would agree that we want to minimize the amount of fruit in juices when we're doing juice fasting. The goal when we're doing juice fasting, we want about 600 calories a day to come in. And the reason is that's enough sugar to maintain the primary brain needs in a resting state. And that avoids the gluconeogenesis. There's other approaches that are used to ensure that sometimes the calories will come in from higher fat foods or products like Prolon. There's different ways to do this. You know, my real expertise is in prolonged water-only fasting. And so although we do use juice diets, our approach is always to get enough calories to meet brain needs so we don't have to go through gluconeogenesis.
What measures should we take to replenish nutrients that may have reduced due to intermittent fasting? So how do we replenish that?
Once we've treated with fasting, many of the malabsorption problems resolve. And now when you get a whole plant food diet, just as you said, the body is able to absorb nutrition, even that may not have been able to absorb it before. We're not into the pill, potion, powder type of stuff, but there are some nutrients, for example, vitamin B12, that need to be supplemented on a plant-based diet because you're not getting the bacterial contamination that all the people eating all fecal contaminated animal foods are. The only place bacteria comes in nature is from, the B12 comes in nature is bacteria. So we do recommend 1,000 micrograms of methylcobalamin a day for vegans because they're not getting the bacterial contamination that they might in a more natural setting. But as a general rule, the plant nutrition is going to provide abundant quantity and quality of nutrients much better absorbed post-fasting. And so nutrient replenishment is basically an important part of the basic primary refeeding process that occurs on whole natural foods.
There's a question here which says, is water only fasting okay for pre-pregnancy situations? Does it contribute to fertility or infertility?
Well, if you're talking about during pregnancy and or lactation, you wouldn't do water-only fasting. You would lose your milk supply. That would be a contraindication. If you're talking about dealing with the problems that prevent people from getting pregnant, I can tell you from personal experience, many of our patients now have kids as a consequence of the, resolving chronic problems that they struggled with prior to fasting. In fact, Dr. Burton, the guy I trained with in Australia 36 years ago, told me a story. He said he was at a fancy party, and a woman came in the room and called across the room to him. He said, "Oh, Dr. Burton, I'm pregnant, and it's all because of you." It was because she underwent a fast and regained her fertility. We've had many patients in the cycle post-fasting achieve pregnancy after having struggled for long times to achieving pregnancy. And so, there's a lot of research that still needs to be done, but you don't use fasting during active pregnancy unless there's a dire situation, and you don't use it during lactation.
Alan, there are a lot of questions on dairy, so basically the questions, I'm just clubbing them together. There are plenty of them, but I think I'm just trying to make sense out of that. So the question revolves around saying that what if we eliminate dairy from our diet, and this whole concern about calcium comes in. And then the other part of it is that, well, we switch from dairy to something else. What would you suggest with so much of alternatives in the market, oat milk and rice milk and almond milk? So yeah. What would be your favorite, or what would your recommendation, or are you neutral?
Yeah, as long as you're not using dairy products, I'm going to be happy with any of those alternatives, but you want to get the kinds without the salt, oil, and sugar added to it, or make it yourself. You can make your own almond milk or oat milk or whatever. The reality is I'd rather see people eating as much as possible whole food rather than a lot of the fractionated processed foods, particularly the stuff that you buy that has all these additives to it.
Here is a very interesting question. Yeah, you might like to take that. Does drinking water with lemon or water with lemon and ginger break intermittent fasting?
Well, I don't know about intermittent fasting, but it definitely affects water-only fasting. We don't, even 10 mils of carbohydrate like you'd get from a little bit of lemon juice would be enough to alter the physiological adaptation to fasting. And so even 10 mils of carbohydrate, for example, will alter the natriuretic effect. When we do water-only fasting, we're using water only, and it's actually highly filtered distilled water only, and we find that's what works the best. Now, in intermittent fasting or in modified fasting regimes where you're giving people calories, that's a whole different ballgame. I wouldn't imagine that a little bit of lemon in the water would be a huge issue.
So when would you do 16 by 8, 18 by 6, and 20 by 4? So there are three.
Well, we use 16 hours of fasting and 8 hours feeding for a routine weight loss or weight maintenance person. If we're trying to gain weight or we have younger kids that need a higher caloric intake, we would use a 12 and 12.
What is your recommendation for kids 10 to 15 years old?
12 and 12, unless they're not getting enough calories, and then we'll broaden the feeding window even further. But 12 hours is usually enough to get enough calories into kids.
Okay, yeah, the question was 12 to 12 or 14 to 10. So you said 12 to 12. Okay. So then the question, next one is, please elaborate on specific foods, a variety of them we should be eating to get all the nutrition and vitamins needed by the body after the days of fasting.
So for every week of water fasting, we start with a day of fresh vegetable-based juices with maybe just a little bit of fruit to increase our caloric intake. We'll do a day of raw fruit and vegetables. Then we'll introduce steamed vegetables. It takes about half the length of the fast to carefully realiment, and it's important that this be done right, particularly in long-term fasting. When you start getting into these 20, 30, 40-day fasts, too rapid a refeeding can result in refeeding syndrome and could even be fatal in extreme cases. So appropriate refeeding after prolonged water-only fasting is a very important part. We will never enter into a fast unless we have a period of half the length of refeeding be done in a controlled, medically supervised setting. And that's how we've managed to do 25,000 of these patients over 36 years without inducing refeeding syndrome or getting into any kind of outcomes of that nature.
Can a person with type 2 DM do intermittent fasting?
Yes, in fact, type 2 diabetes is one of the conditions that we have the most experience in managing. Fasting reduces insulin resistance. And so for patients that are producing insulin, in other words, if their C-peptide suggests they're making insulin, it's very likely that they can achieve dramatic improvement and in many cases normalize blood glucose without the need for medication. Now, sometimes you do have to modify the dietary regime further to limit even fruit intake and others, especially fruit juices and things like that, in order to maintain good glycemic control. The HOMO-IR is temporarily increased initially after water-only fasting, so refeeding is critically important to be controlled in diabetics. And then we're doing a study right now that looks at HOMO-IR at 6 weeks post-fasting. We know that or we suspect that it comes down and improves dramatically because of what we see clinically. But we just finished a study with the Mayo Clinic that looks at body composition changes in fasting. This paper's in review right now, about 2 months in. It hasn't been published yet. But it did show an initial increase in HOMO-IR when you first come off water-only fasting. And we believe that there's a rebound effect that, and now the study we're doing right now looks at that same variables, but at 6 weeks post-recovery, where we expect we'll find it significantly reduced. So anyway, the point is that there's big dynamic changes that occur in fasting. There's been very little research done on it. A lot of what we're doing is really virgin data. And I'm excited that now some of these big name research facilities are actually collaborating with us because we're one of the few places that have data on long-term water-only fasting. We also have our own research laboratory now. We can extract samples. We can freeze them at 86 below. We've got refrigerated centrifuge and all that stuff. We've also got an affiliated IRB with federal-wide assurance, so those studies can be approved by people that are familiar with fasting, which is a pleasant change from the past. And we have a research team. We have Dr. Tasha Myers, who's a PhD postdoc from Columbia, who's brilliant, and another PhD and another MD that have joined our full-time research staff. So we're really putting ourselves in a position to take a look at these biological and biochemical changes that are occurring in fasting and hopefully be able to disseminate that research through our website. Fasting.org is a fasting compendium website where all this information will be shared.
Does BPH client benefit from water fasting?
Benign prostatic hypertrophy with long-term water fasting sometimes does have a profound effect, and particularly on the, people frequently will go where they're waking up every hour. By the time they're done fasting, they'll be waking once or twice a night, and that's the routine, not the exception. Actual enlargement itself can reduce, although sometimes that does take longer fasts or multiple fasts to get significant measurable changes. But the symptoms that drive people crazy with BPH are often profoundly affected during fasting.
Okay, the next question is, I'm healthy with no known medical problems. Would a water-only fasting be helpful to me?
I believe so. I think we're going to find that the people that get the most benefit from fasting are actually the healthy people using it preventatively. I and my staff all fast for a week or so a year just as a preventative measure. We're doing a study that will start in 2021 that's looking exactly at this variable, looking for reliable biomarkers, including some exotic biomarkers, including things like the number of mutations inside B lymphocytes and the response of cytokine response and the measures that predict that in healthy people. Because what we believe we're going to find is those markers of health are enhanced with a whole plant food diet and enhanced further with fasting. We can't prove it yet, but that's exactly the question that we're answering. In the current environment with COVID, for example, where you have some people getting infected and not even knowing they have it or it's very mild, and other people having terrible, devastating, or deadly effects, you have to start asking, why is it that some people are dying from this and other people are, recovering as they would from other, serious infections? And one thing that seems to predict death appears to be metabolic syndrome itself. So the overweight, the diabetes, the cardiovascular disease, some of the medications associated with it. my opinion is that, yes, we should avoid exposure to infectious agents by washing our hands and wearing masks and doing all the things that are being advocated. But we also should be taking responsibility to improve our health so that when we do inevitably get exposed to whatever it's going to be, we have the ability to recover and not be killed because our body develops an acute immunological reaction because we're not as healthy as we should be. And so I think this should be a motivation for us to not only apply the hygienic practices that are being advocated, but also to start taking seriously the fact, because believe me, I don't think this is the last serious problem we're likely to face in our lifetime. There's going to be other problems that come along, and the healthier we are, likely the better we're going to be able to be in a position to try to have a less serious effect and recover.
Are there specific vegetables, raw, steamed, you recommend for increasing healthy gut bacteria?
Well, we're fortunate to have a wide variety of healthy vegetables, and I advocate a seasonally varying exposure to all these wonderful vegetables, particularly those dark green vegetables, the ones you think about, the chard, the kale, the collards, incredibly rich, the broccoli, the Chinese greens. These green, rich, nutrient-dense vegetables are very low in caloric density, low in fat, but rich in nutrients. And so getting large quantities of those in every day, huge salads, lettuce, cucumbers, tomatoes, etc. I tell people you should eat such a big salad, anybody looking at your salad would recoil in shock and say, oh my gosh, you're not going to eat all that, are you? Because if they're not reacting with shock and awe, that means you didn't get a big enough bowl. You need to eat so much salad and steamed vegetables, there's not much room to eat anything else, and the tendency to overeat gets dramatically reduced. So lots of salad and steamed vegetables, enough complex carbohydrates so you don't get too skinny, an ounce of nuts or seeds a day, and avoid basically everything else. I tell my patients that one way they can tell if they should have something is to look at it and go inside themselves and ask themselves quietly, do I really want and need whatever it is? And if the answer is truly yes, you know. You can't have it. You get nothing. If you really want it, there's a reason. It's because it's a pleasure trap, drug-induced response. It doesn't mean you won't like your food. You will. But you're never going to wake up at night and have to rush down to the store because you ran out of something. You can wait till the morning. If it's so urgent that you can't wait, usually there's a reason.
Just to avoid sugar, if you use coconut sugar, is that okay as a substitute?
No, sugar is sugar is sugar. Any refined concentrated sugar is sugar. Now, the fact that it may have some contaminated minerals or other beneficial things maybe makes it less bad, but something being less bad doesn't make it good. It just makes it less bad. And what are you having to add sugar to? It's usually highly processed food products that don't taste good because you've taken out all their natural flavor. If you really focus on eating in whole foods, there's not the tendency to be having to add all this sugar, oil, and salt to it.
What kind of water should we use at home for water fast?
Yeah, you want water that's just, well, keep in mind that as far as intermittent fasting that you're doing at home, purified water, whatever it is. We use distilled water. That's the purest water. You could also use reverse osmosis. There's lots of different ways to purify water. You just want H2O. You don't want the hydrogenated halocarbons and the chlorine and all the other byproducts that might be showing up in your water, the cryptosporidium, the viral contaminants, etc. You just want pure water. And so you use some type of reliable purification system to purify your water. We don't recommend people do long-term water-only fasting at home. We recommend that they do that after there's been a history exam lab and proper monitoring that's being done.
We would like to hear some message.
So, life at True North Health is a unique environment because you have a bunch of highly motivated, self-selected people that all working together with a bunch of doctors that are happy to be there because they're some of the only docs that get a chance to actually see people get well. So we're having these patients that we're pre-selecting that have good outcomes, and it's a rewarding, exciting place to be watching people recover their health. We know that health results from healthful living. So our job is to educate people to eat well, exercise, and sleep, and we're experts at doing long-term water-only fasting when that's appropriate. As far as telehealth, if you want a doctor that's not an idiot, that's able to think in terms of, help and guide you get well, you can go onto our website at healthpromoting.com, fill out the registration forms. They'll review your medical history, and they can offer you, telehealth services and phone coaching services. If you want a screening call with me to find out whether any of this kind of stuff is applicable to you, all you have to do is go to our website, fill out the registration forms, and give me a call. There's no cost for that. I'll be happy to talk to you.
Alan, there is one question I'm very tempted to put forward. There's somebody who's interested in volunteering at True North. So how the person should get going with that?
I'm sorry, about volunteering?
Volunteering, yeah, they want to volunteer at True North. Yeah.
Well, right now we have a program for physicians, doctors, chiropractors, naturopaths, medical doctors, osteopaths, and they can actually come in. There's no cost to them. We provide them room and board and training, and they spend, whether it's a month, 3 months, or a year with us, depending on which program they're in. And so that's a program. If you have a doctor that you know that wants to do something worthwhile with their life and learn how to get sick people well, we welcome them to come in, and we'll teach them everything we know, and they can utilize that to the best of their ability. We don't have the capacity to house other people now because we're about 2 months booked out. So space is a real limiting factor for us right now. So we don't have other programs yet, but hopefully someday the opportunity will come up that we can expand our program. We have about 70 employees on our staff right now, and they're really fabulous. We've got just some of the greatest people you can imagine. They've come from all over the country, and in fact from all over the world, because it's such a unique environment, particularly for healthcare practitioners, as I said, to work with people that are going to actually get well.
Okay, so there is one question I'm again very tempted because this has come from somebody who has been attending your sessions very regularly. And this is basically, I don't consume added salt. How I can track what I'm consuming, that I'm consuming enough iodine. So how do you track iodine?
Iodine, yeah, that's a good point. Iodine is added as an additive to sodium. So people that are not eating table salt. Normally, if you eat enough vegetable materials, you get enough iodine. But if you want to augment that, you can include a small amount of sea vegetable, like kelp and other things in the diet, which are very rich in iodine. Or if you want to, you can supplement iodine as well.
Yeah, there's another question which I thought was very important related to is there a medical test to make sure that I have enough iodine in my body?
Because it's a challenge test, it's not easy to test iodine. If there's a deficiency, certainly that can be determined. But in our diets, because we'll include small amounts of sea vegetable material as a routine, it really doesn't come up. We don't see iodine deficiency as a routine issue. If there is a condition that makes iodine a concern, then supplemental iodine is a very inexpensive and simple thing to do.
Thanks to you, Alan. We will definitely continue this